What you can expect at Sleep Solution Centers is a comprehensive consultation where we listen to what your true problems and struggles are. We customize a plan for you. We're here to make this process easy. Thank you for watching the video. We look forward to seeing you in our office very soon. By watching this, you're receiving half off of your initial visit. It shows that you're just as interested in what we have to offer as we are in helping you. Our team will be contacting you shortly as soon as your paperwork's completed. We look forward to seeing you soon. At Sleep Solution Centers, everything we do begins with one essential truth. Breathing correctly is the foundation of healthy sleep, and healthy sleep is the foundation of long-term health. Many people live for years believing their symptoms are isolated problems. Loud snoring, chronic fatigue, teeth grinding, jaw pain, anxiety, brain fog, poor focus, bedwetting for children, ADD, ADHD-like behavior, frequent waking at night, morning headaches, dry mouth, restless sleep, and the list goes on. What most people do not realize is that all these symptoms are commonly connected by the same root cause, a restricted airway. Breathing is meant to happen quietly and silently through the nose. When nasal breathing is compromised, the body shifts into mouth breathing. During the day, that already strains oxygen delivery, but during sleep, it becomes far more dangerous. When you sleep, the muscles in your throat naturally relax. If the airway is narrow or underdeveloped, the tongue and soft tissues can collapse backward, blocking your airflow. The brain senses falling oxygen levels and forces the body to partially wake up to reopen the airway. This may happen dozens or even hundreds of times per night, often without the person ever realizing it. The result is fragmented, non-restorative sleep. You may sleep for 8 hours and still wake up exhausted. Over time, this puts the body into a constant stress response. Hormones become unbalanced, blood pressure rises, inflammation increases, memory and focus decline, the immune system weakens, the heart works harder, the brain never fully resets, the body never fully recovers. This is why untreated airway obstruction and sleep apnea are linked to cardiovascular disease, diabetes, anxiety and depression, weight gain, cognitive decline, chronic fatigue, behavioral challenges in children, and reduced life expectancy. Children are the center of our mission at Sleep Solution Centers. Airway health during children determine how a child grows, sleeps, behaves, and develops. When the jaws do not grow to their full natural width, the tongue has less room for its ideal position. This can cause the tongue to fall backward, contributing to airway restriction, poor sleep quality, facial developmental changes, tooth eruption issues, posture problems, and behavioral difficulties. Children with airway restriction often present with mouth breathing, snoring, restless sleep, bedwetting, crooked or crowded teeth, hyperactivity, poor concentration, daytime sleepiness, learning struggles, ADHD, and grinding your teeth at night. This is why we hold one of our core mottos, Fix by 6. We strongly recommend evaluating and beginning treatment by ages 2 or 3. Early airway guidance allows children to grow properly, meet their developmental milestones, and truly thrive. At Sleep Solution Centers, we evaluate the airway, not just the symptoms. We use advanced diagnostic tools, including home sleep testing, 3D airway imaging, rhinomanometry for nasal airflow and analysis, and comprehensive functional assessments of jaw position, breathing patterns, and sleep quality. Based on these findings, we create fully individualized treatment plans designed to gently open the airway, restore nasal breathing, and stabilize sleep. For children, we focus on early airway guidance rather than waiting for problems to become severe. Pediatric dentofacial therapy helps guide jaw growth, promote proper tongue posture, establish nasal breathing, and reduce the need for aggressive orthodontics later in life. These devices are worn primarily at night and work with natural growth patterns rather than against them. For adults with snoring, teeth grinding, TMJ dysfunction, daytime fatigue, or mild to moderate sleep apnea, we offer custom oral device therapy. These devices gently reposition the lower jaw forward during sleep, helping the airway open without masks, hoses, or invasive surgeries. Many patients experience dramatic improvements in energy, focus, mood, and sleep quality within days. For adults, more advanced sleep apnea, CPAP intolerance, or severe airway collapse, we offer rehabilitation-level oral devices designed to create long-term airway change. In many cases, these devices can reduce or even eliminate the need for CPAP over time. We also offer powerful supportive therapies that enhance airway stability and breathing function. Quiet night laser therapy stimulates collagen, tightening in the tissues or the throat to reduce snoring and airway collapse. Nasal release therapy, also known as neurocranial release, improves nasal airflow and sinus drainage to restore proper nasal breathing. Oral myofunctional therapy retrains the muscles of the tongue, lips, cheeks, and airway to stabilize breathing patterns. Ozone therapy reduces inflammation, enhances oxygen utilization, and supports optimal breathing and tissue healing. Sleep Solution Centers is not a symptom-based clinic. We are an airway-focused sleep and breathing center. Our goal is not simply to make patients quieter at night. Our goal is to restore the body's natural ability to breathe, sleep, heal, and function at the highest level possible. When breathing stabilizes, sleep stabilizes. When sleep stabilizes, the body enters true recovery. Patients often report deeper, uninterrupted sleep, clearer thinking, increased energy, reduced anxiety, improved mood, elimination of snoring, less jaw pain and clenching, better athletic performance, improved behavior and focus in children, resolution of bedwetting, stronger immune health, and much more. When you breathe correctly, you sleep correctly. And when you sleep correctly, your life changes. At Sleep Solution Centers, our purpose and how we're different from other doctors that you may be seeing is that we address the root cause of your problem. Our focus is not to address your symptoms, but actually, what are you suffering from truly, and get to the root cause of that. Through our evaluations, we entreat the entire airway as well as the entire body. No drugs, no surgeries, no machines. We do our best to allow our body to heal by giving it what it needs. That starts with a proper breath. We focus on what's first and foremost and help our bodies thrive, as that's what they're designed to do. We're unlike any other practice in the world, and we have patients travel from all around the world. Our treatment is customized to your needs. From your first breath to your last, we are here to help, and our approach is holistic. We want to address the entire body to create proper breathing and proper function. There are very few practices that collaborate the way that we do and offer the types of therapies that we do. And this is what makes us truly unique. Upon completion of your first visit at Sleep Solution Centers, we will be meeting in here in one of the consult rooms to discuss your customized treatment plan. The way that we come up with this plan is based on the head and neck exam that's performed, your chief complaints that you're presenting with, your medical diagnosis, as well as the imaging that we have taken at this appointment. The customized treatment plan is primarily focused in adults at addressing things like sleep breathing disorders such as sleep apnea, head and neck pain, TMJ disorders, headaches, anything like that. And most patients don't realize that there's a treatment landscape for different ways to be able to treat obstructive sleep apnea and sleep breathing disorders. The most common being CPAP, as well as surgical procedures that have been traditionally performed, and then oral devices or mouthpieces as we often use in our practice here. As previously discussed, we do take a comprehensive care approach and very conservative as we are addressing more of the root cause of your problems to help prevent long-term health issues, allowing you to breathe better, sleep better, and live better. We have a table that shows a comparison of some of the other cost of therapies that could be offered, such as surgical treatment options, which are more major treatment that can range $60,000 to $80,000. CPAP use over 10 years is average $10,000 or more for consumables, not to mention the failure rate being so high. And then when you get into the oral devices or mouthpieces, that is considerably more economical. So I want to give you the landscape of what your treatment options are for an adult and where we fall into that. We are a fee-for-service practice, and again, we focus on addressing the root cause of these breathing and sleeping issues for you. The custom price typically ranges somewhere between maybe $4,500 to $8,500 if we're addressing all three parts of the airway. So that would include something like an oral device mouthpiece, treating the upper part or the middle part and the lower part of the airway. So comprehensive conservative care. Another thing is that most people don't realize not treating obstructive sleep apnea. On average, recent studies have now shown that this can cost you $3,000 to $6,000 more per year because of other undue health expenses, hospitalizations, medications, doctor's visits. So not treating your apnea is one of the most expensive costs that you will have in healthcare as well as your longevity. So really a minimal investment like this is something that is very smart for your overall health and wellness. We do offer flexible financing options like Care Credit, which is a 0% interest for most people spread out over 24 months or more. So for as little as a few $100s, you could actually be sleeping and breathing better very quickly. We look forward to helping you with that. For children's care, this is very similar to comprehensive orthodontic treatment. So for children, we start younger than 10 or 12 years old when traditional orthodontics or braces are typically recommended for kids. We actually start as young as when a child is born, and oral devices can be used immediately. And we want to address the root cause of what's going on for children as far as helping them grow and develop well. So the average cost of orthodontic care or braces today for a 12-year-old on average is $6,000 to $8,000. When we start younger in children, it saves you thousands of dollars, not to mention the fact that the child begins to thrive very quickly and they grow and develop well. So by starting early, the cost for children's care can range anywhere from a few $1,000s up to maybe $6,000 or $7,000. However, by addressing it early, again, we're not suffering for all of those years. And then traditionally, we typically don't even need orthodontic or braces later in life by treating the problem early. And again, we provide Care Credit and other options to make monthly payments and spread this out over time. So as little as a few $100s a month, you can be getting your child sleeping and breathing better, and that way the whole family is sleeping and breathing better.